Hello everyone, welcome to the Osteoarthritis Action Alliance Lunch and Learn webinar for May 16, 2018. Thank you for joining our presentation this month. Our presenter today is Megan Janke. Dr. Janke is an associate professor in the recreational therapy program at East Carolina University. She has been a certified therapeutic recreation specialist since 1998. She has received external funding and published over 20 articles examining the effects of leisure activities and other interventions on older adult health, including several in the area of arthritis. Welcome, Megan.
Thank you. Well, I'm happy to be able to give this presentation today. And as Haley introduced me, I've done a lot of work on arthritis and leisure activity, so I'm going to go through a brief presentation, and if anybody has any questions, just let me know. And if you have any trouble hearing me or understanding anything, also give me a heads up. But like I said, the title is Impact of Arthritis on Meaningful Activity Involvement and How We Can Use Those Types of Activities for Health Promotion and some strategies. Some background, which a lot of you are probably familiar with, for kind of a focuses or leads into this, is that we have about 44% of adults in the United States who are 18 and older who have activity limitations due to their arthritis. And not necessarily that they have arthritis, but they have limitations in their activities that they do. As it relates to sort of that meaningful activity, there's some research that really suggests that once people get diagnosed with arthritis and their pain and other symptoms become more severe, one of the first things that they end up giving up really are these meaningful activities or leisure activities. So some research suggests that they give up to maybe even 2/3 of the activities that provide a lot of meaning to them or those leisure activities after diagnosis. Others have found that it wasn't quite that much, that maybe it was only 10% of their valued activities, but that was a strong predictor for depression in those individuals. And we know that the arthritis pain can affect individuals' mood and their ability to do different things, activities of daily living and other tasks. But it also reduces their ability to perform meaningful activities. And I guess why that's important from my research, I found a lot that meaningful activities are those things that people have, they value the most, so they have the most need for in a lot of ways. And so that really does have an effect both on their physical and on their psychosocial outcomes. But we do know that the voluntary nature of some of these activities makes it easier for them to give them up initially sometimes. Related to that can be leisure time, physical activity, or exercise, which we tend to focus on the most with arthritis because of all the health benefits that go along with it and the fact that individuals with arthritis don't exercise as much as the general population. So we know that only 24% of adults with arthritis get any kind of recommended levels of daily activity or physical activity. And that percentage can be lower than the general population. A lot of adults with arthritis obviously are going to choose to be physically inactive based on their symptoms. How that relates to meaningful activity is also that some older adults aren't prioritizing exercise. So to them, exercise and physical activity might not be meaningful, and so it's easier for them to give that up as well. And so if they don't perceive it as something that they enjoy or something that's a priority for them, they don't necessarily get the health benefits of maintaining that involvement, they're going to be less likely to adhere, and which is probably why we see those lower levels. And they are more likely to give in to those barriers to participating in those activities and stopping exercise once they have that diagnosis or those symptoms become more severe. We focus a little bit less, though, on the effects of arthritis on other types of activity participation. And so I wanted to kind of highlight some of this aspect. So for many people, even though exercise might not be a meaningful or enjoyable activity to them, their social participation is. And some of the more recent statistics on how arthritis affects adult social participation shows that it's pretty significant. If you look at this chart, some of you live all over, so you can kind of pick out your state and see what the effects are in that specific state, but the prevalence of an age-adjusted arthritis attributable social participation restriction ranges anywhere from about 1 in 8 to more than 1 in 4 or 25% of adults with arthritis, depending on what state you're looking at. So it is a significant problem for these individuals. My research has really looked at qualitative and quantitative aspects of what these activities mean for older adults. And most of the individuals that I've had in my studies indicate that the most meaningful or important activities to them are going to be those that include spending time with their family or engaging in some kind of favorite hobby or interest, which is often socially, there's often a social component to it, I guess I should say. And so those activities kind of provide them with that diversion and allow them to forget their symptoms for a while. So while exercise is important, it's also important for us to remember that some of these activities that they're not participating in have a social component, or maybe primarily social, but that also can influence and affect their health. So I guess the so what message and why are meaningful activities so important? There has been a lot of specific research that links whether health and well-being to involvement in meaningful and productive activities, whether that's leisure or defined as a productive and valued activity. So we know that arthritis is associated with increasing individuals' risks for mobility limitations and poor health, increasing depression, increasing anxiety, increasing pain. And participation in these meaningful and productive activities has also been linked to a lot of health outcomes that can affect those or kind of maybe mitigate some of the effects there. So it decreases mortality, reduces depressive symptoms, decreases functional limitations, improves cognitive functioning, and can increase their life satisfaction. So there's a lot of ways that these meaningful activities can kind of counteract some of the side effects and symptoms that they're having due to arthritis, if we can maintain that type of involvement and that participation. One of the things that I've looked at a bit is how we can use meaningful activities for self-care. So there's a lot of talk about self-management with arthritis, since many individuals are self-diagnosed, or once they're diagnosed by their doctor, a lot of their self-management is really, a lot of that management of their symptoms is up to them. And leisure activities can be one form of self-care or self-management for people with chronic conditions, including arthritis. So we've found that people who have arthritis who are able to replace an activity that they can no longer do because of their arthritis condition or the functional limitations are better able to cope with their condition. The problem is that we don't often inform people about ways of how they can replace those activities or ways that they can maintain involvement. There's also a lot of research that suggests that just having that sense of belonging or that social aspect of activities, whether that's as part of a physical activity or exercise group, or whether it's a different type of leisure activity, increases adults' ability to cope with their arthritis as well. Part of that's due to the social support, and then part of that's also just due to the health benefits, the improvement in quality of life, and psychosocial well-being that comes with those social engagements and maintaining some of those meaningful relationships. And some of my research has also looked at the fact that we know that everyone has a different leisure style. So there are going to be some people who are diagnosed with arthritis who have been very physically active and who have very physical exercise-based leisure styles. But then there's a lot more individuals who don't. And so we need to figure out ways that we can work with all of those individuals to maintain their physical activity levels, but also maintain other aspects of their meaningful activities. And so we can use some of these other activities that they have an interest in to boost their energy expenditures or their means of exercise. So even if they're not engaging in a lot of moderately intense activities, maybe we can find a lot of light intense activities or kind of less vigorous activities that they can do, but we can add them all together, and if they do more of those, that accumulated benefit from those activities can be very helpful and is associated with health outcomes and improved health outcomes for individuals with arthritis as well. So a couple tips and things that I just wanted to identify moving forward that might be helpful for you as you're working with clients. Obviously, we do a lot of goal setting and action planning already, probably. It's fairly common in our approaches, although maybe we're not as focused on meaningful activity in terms of setting goals for our clients as much as we maybe are for exercise or some other aspects with these individuals. So it might be really useful to help them really think about some of the meaningful activities that they like to do or want to do and make some goals and action plans associated with those. And making those smaller goals more achievable so that they can see progress. But if we do that, kind of helping them problem solve some of the areas and overcome some of those barriers that they might have to doing those meaningful activities due to their arthritis, focusing on that confidence and self-efficacy to help them achieve those goals, and kind of really working in that area. A lot of times I'll hear from individuals with arthritis that their goals may be very focused on a social engagement or social event, so that they really want to go to their granddaughter's wedding, but they're not sure that they'll be able to walk down the aisle or things like that. And so finding ways to help them achieve some of those goals can be really important. One of the ways that my research has kind of looked at that is through optimizing their performance and engagement through kind of maximizing their resources or utilizing some of the resources that they have, or compensating through adaptations and assistive devices. So we can help older adults or individuals with arthritis by maximizing the strengths and abilities that they do have. So instead of focusing on what they can't do, maximizing what they are able to do, and that can be really helpful. Prioritizing, which kind of goes into that goal-making aspect, can be important. And then taking into account the times of day, maybe when their symptoms are less severe, and maybe planning activities when that might be more possible for them. Compensating through adaptations and assistive devices can include things like modifying the actual activity. So there's lots of ways we can modify activities. Some of the most common ones are going to be things like, instead of running, they can walk. But there are also a lot of devices out there if they no longer can grip a tennis handle, the racket as well, that can help them do that. So there are things that we can do to kind of modify those as well, or use assistive equipment to participate in the activity if that is the only way that they can do that. That might be including or using like a walker. It could be using something to help with gardening. There's a variety of ways to do that. But research really has found that adults are really willing to find new standards of participating in those activities and valued activities when their arthritis pain and symptoms interfere. But there's varying levels of their ability to do that. So I've done some research with individuals who have lower levels of resources or lower socioeconomic status, and they seem to have different approaches and some different forms of knowledge, I guess I would say, in terms of seeking out resources and how to do some of those things, which can be a factor. And then other tips would be things like leisure education and identifying potential community resources for them. So understanding that their awareness and perception of resources are going to vary greatly. And those resources could be places where they can go to engage in leisure or meaningful activities like community centers, YMCAs, parks. But it could also be things like people, organizations, or support groups. A good example that I had from one of my research was I had some adults who had very high resources or higher socioeconomic status, and a lot of them went to the internet to find tips and resources. They were very aware of what was going on in the community and very connected to community resources. They had the money and often lived in places where they could go to a gym or had safe places to walk. But my older adults in the study that were living in subsidized housing and not quite safe neighborhoods didn't have those same resources. So a lot of them wanted to exercise but didn't really have a safe place to do that. And a unique difference in that group was that the adults with fewer resources actually would go to the hospital, to the physical rehab kind of facilities there, and got permission to do some exercise there, sometimes by their physician. But their perception of what is available to them varied, and not everyone in that lower income group perceived that as a resource or were even aware that it existed. Another type of resource can be role models and social support as well. And so they look to other people in terms of what they can do and what would be capable of doing. And so that can also be a factor. As I said, some people are very technologically savvy and know how to search for those models and ways to adapt things, but many other adults are not and maybe don't have access to that. And I guess in terms of this self-management of meaningful activities, it's not something that the physicians or healthcare professionals often focus on as much. So they're not going to be provided with this type of information when they're in the healthcare setting. Very often it's usually up to them to find it. And most often they hear about exercise, but they don't necessarily hear about some of the other ways that they can engage in activities that are enjoyable and meaningful for them. So in terms of promoting that meaningful engagement, some of the strategies that we can use, one I would say is just educating clients about some of the potential detrimental effects of limiting that leisure and meaningful activities when they are faced with arthritis, whether it's eliminating 10% or reducing their involvement in valued activities by 2/3. That's still a substantial loss of some of these activities, and the individuals really value quite a bit. But a lot of times if you ask them, they might not have the same, might not understand what that means to their health or the consequences of giving up those activities necessarily. They might not understand that research, so educating them on that can be really important. But we can also discuss with our clients ways that we can incorporate a healthy mix of different types of activities into their repertoire, because we obviously want to increase their physical activity. So trying to get them more physically active, maybe by incorporating a social component, which may be more motivating to them, can be really helpful and beneficial. So the example on the screen is providing or having a picnic in the park with friends and then followed by a walk around the park to try to integrate both of those types of activities and then motivate them a little bit more. And then just encouraging participation in a variety of activities. So while we want them to be physically active, giving up on social activities, cognitive activities, and others can also hurt them in other ways. So trying to make sure that we look at the broad spectrum of involvement, what they like to do, what's meaningful to them, and trying to get them to stay engaged overall rather than dropping out of some of these activities that are very meaningful to them and could have a significant consequence on their health should they stop them. All right, and that kind of is my main suggestions and sort of approaches, but I didn't know if anybody had any questions or
Thank you, Megan, for that presentation.
I can go into
Just
some of
a
that
reminder,
as well.
you can type any questions you have in the chat box in the bottom right. Well, I do have one question, Megan. So in our healthcare systems work group, we are discussing community clinical linkages. So do you think that practitioners' recommendations for community-based programs will become a useful strategy for patients in the future? Yes, I can. So I said in our healthcare systems work group, we are discussing community clinical linkages. So do you think practitioners' recommendations for community-based programs will become a useful strategy for patients in the future?
I do, actually. I think a lot of times the adults that I've spoken to really do take to heart what the information that's passed down to them, and they are looking for resources and ways to self-manage their condition and try to improve their health and well-being. So I do think the more that we, as clinicians or kind of the healthcare community, passes down those suggestions for those community-based resources and refers them to things that they can do that may help them maintain that involvement, I think will be very beneficial. Because from what I've found, a lot of adults, particularly the ones that don't have as many resources, really are looking for them, but they don't necessarily get a lot of information about it. So they're on their own unless it's, they get the information from someone else. So I do think the more we can sort of prescribe or refer those programs, I think the more use that they will get. You're welcome.
Does anyone else have any questions? So Ruby Davis asks, will the recording and slides of the presentation be available? Yes, we will put the recording on our YouTube channel, and Megan, would you mind sharing your slides as well so we can send? Okay, thank you.
Yeah, that's fine. I'm happy to do that. No problem.
Okay, so that looks like all the questions that we have in our chat box. So thank you, Megan, again for your presentation, and thank you all for joining us today. So tune in for our chat next month, and a brief announcement to tune in on June 20th with Dr. Jackie Whitaker, who will discuss targeting secondary prevention for OA, who is at greater risk for following joint injury. Thank you again, Megan.